for cancer sort of to begin or to continue to grow and divide. So definitely, in their house, in their world, and obviously we can't get away from it completely. We're always
like anger, and they tend to be people pleasers. Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am joined again by the amazing and wonderful Emily Carhill. Emily, thank you for joining us. Let's start with that of just the pathophysiology of the disease and what kidney cancer actually looks like versus chronic kidney disease.
Sure. So kidney cancer has actually been on the rise, sort of similar to kidney disease. Sort of since the 1970s, the incidence of kidney cancer has been increasing, which may partly be because we are better at picking it up, but also because a lot of the risk factors are, sort of, I guess, lifestyle type things as well. So, I guess going back to what cancer is. So cancer's when cells in the body have become abnormal for some reason and they start to grow and multiply too quickly and sort of out of control. So our body doesn't have the same checks and balances that it usually would have to keep control of these cells. And they also don't act on their own. So cancer cells also enlist, our other body cells, genes and proteins and things like that in the body to help them to continue to grow and divide. So it's, I guess, a little bit similar to kidney disease. Symptoms or signs of symptoms of kidney cancer don't often come up until the cancer is sort of a little bit larger and a bit sort of further along because some of them are quite vague. And they're also actually quite similar, to signs and symptoms of kidney disease. So things like having blood in your urine, having pain on your back, sort of on one side. Sometimes people can get a sort of a bit of a mass or a lump on one side of their back, loss of weight, loss of appetite, fever. That one's obviously different from kidney disease, and anemia. So I'll often see that people are diagnosed with kidney cancer often actually when they're getting investigations into something completely different. So they've got something else going on and they've had a scan and it's been picked up then, rather than, having signs and symptoms and going in and sort of getting those investigated.
Yeah, that's so very true, isn't it? With cancers in general, not often, but they can be one of those things that get picked up as a anomaly for other things. And I definitely know that's the case with kidney cancer, because I guess a lot of people aren't thinking kidney cancer with those sort of, and they're quite vague symptoms really, a little bit of lower back pain. Unless you've got the blood in the urine, the rest could just be, oh, I've got a bit of a fever, I'm a bit fluey, I'm just a bit achy. I guess no one's going to be thinking of kidney cancer. What sort of advice are you giving to people of things that they can implement into their lifestyle that we know will have a really positive effect?
Yeah, so definitely exercise is a big one.
Yeah.
Managing stress, I think, is really important. We all have a lot of stress in our life as it is, and then add a cancer diagnosis on top of that. There again, we know from the research that high levels of stress help to, one of those things that can happen for cancer sort of to begin or to continue to grow and divide. So definitely doing something that they're managing their stress levels. I also will often get people to do some intermittent fasting. Appropriate. There's a lot of research and sort of we're seeing more and more onto the benefits of intermittent fasting in people with cancer. And then, being that kidney cancer is something that develops as well because of toxins. The other thing is, having people start to reduce the toxins that they're exposed to in their house, in their world. And obviously we can't get away from it completely. We're always going to be exposed to some level of toxins, but it's thinking about the areas where you can start to reduce your exposure can be really important as well.
Yeah, that's all really good advice. And I think I'm reading a great book, or reread a great book, which I get a lot of my patients to read, which is called When the Body Says No. And there's actually, you may know more about this, but there's a cancer personality type. And they call, we've got personality A, personality B, and personality C. And personality C is the cancer type far more likely to develop cancer. And one of the things that they've proven in studies is that cancer patients generally have a poor ability to express their emotion. They often repress things like anger, and they tend to be people pleasers. And what I found really, really interesting in the studies that I've just been looking into, mindset, obviously I have a special interest in that, is that people that were positive all the time, so were really positive about their disease and they implemented positive thinking, had far worse outcomes in cancer than people that were negative thinkers, which is funny because one of the things that especially the personal development community often says is positive think, think that you'll be okay, all of that sort of stuff. And actually the studies are showing that people that think positively had much poorer outcomes. Now, that's not to say that people should be pessimistic and sad about their cancers. It was more to do with the denial of actually how people were feeling and the not acceptance of actually where they were at with the diagnosis, and the brushing away of actually honoring where they were was what caused, and it caused the same level of stress as going through a divorce. So the denial of emotions will release those chemicals to that same degree, which I find fascinating because it is often, if people are not well versed in the personal development world and they step a toe in there, they're all told to think positively. And now we know that the long-term outcomes of thinking positively in cancer, and that's what the research was specific to, is lower. So I found that really fascinating because I hadn't come across that research before to show that I thought positive thinking, I knew that it was a bit lopsided, but not that it actually worsened that cancer outcomes. So thank you, Emily. I really appreciate your expertise in this area. And make sure you hit subscribe. If you want more information about who we are at Kidney Coach, head over to www.kidneycoach.com. So until next time, make sure you subscribe, give us a like if you like this information. And if there's any specific topics you want to know, make sure you add it in the comments below. All right, have a wonderful day, Emily. Thank you. And we'll talk to you next time. Bye.